we have been, over the last day or so, doing a series of stories on kids and mental health, something that has been described as a crisis, as an epidemic within the pandemic, anxiety, depression, even suicide rates at really disturbing numbers across the country and also right here in Indiana. So we've done the stories on TV, we've put the stories online at WTHR.com, but we wanted to give you the opportunity to kind of be able to join this discussion with some mental health professionals who might be able to help answer your questions and help spread this word and get kids the help that they need. So I want to quickly introduce Dr. Hillary Blake, a child and adolescent psychiatrist at IU Health Riley Hospital for Children, and also Kimball Richardson, who is a licensed mental health counselor, clinical social worker, marriage and family therapist, and clinical addiction counselor with Community Health Network. So we'll be talking and to the two of you, we'll kind of be bouncing back and forth between the two of you. If you want to jump in, feel free to jump in. I know, this is Zoom. You may talk over each other. That's our world today. So we'll do it that way. If you on Facebook have a question you don't want to publicly ask in the comment section, you can email me at dustin.grove@WTHR.com and I'll ask them for you. Dustin.grove@WTHR.com. It's right there in the corner of my screen. Let me first ask you, and let's begin with Kimball Richardson, if you don't mind, sir. What have you experienced the last 2 years in terms of kids and mental health? What's going on?
Are you posing that to me, Dustin?
Yes, yeah.
I'm so sorry. Hey guys, I'm so sorry. I love technology, but for some reason I can barely hear you. So I'm going to try my best to understand what's being asked. Well, we've been incredibly busy in the past couple of years, but especially in the past 2 or 3 months. We've seen the highest volumes we've ever seen before in the history of having mental health services at Community Health Network. 2 months ago, we had 5,100 requests for outpatient counseling appointments in 1 month. That's good in a way because people are recognizing I need some help and there are mental health professionals out there, but it's challenging in another way. It's tough to fill all those requests for sure.
Yeah. Dr. Blake, I know you and I have talked before. You have seen very much the same thing over the last year or so. Why do you think that is?
So I think, well, first of all, I have to correct you on one thing. You said I am a psychologist, not a psychiatrist.
I'm sorry.
So, no, you're fine. So I think, I think part of it is it started off with the pandemic, right? These kids were socially isolated and they were having less social interactions. They were at home, not performing as well in school. And then we saw the added stress of just COVID in general, right? And when we look at, especially our admissions to the hospital in terms of kids who have attempted suicide and the numbers of people calling in, we have just seen those numbers continue to increase and they haven't gone down, right? Despite the world opening back up and people, having, more social interactions and things like that. And I think it's just kind of opened up almost like a can of worms of, anxiety and depression in kids, especially increased stress in parents that's trickling down to kids. So I think it's just kind of open Pandora's box, as to say, right? Yeah. Of everything that kids are dealing with today.
So somebody asks on Facebook, how can we as a society help these kids cope and recover? This person said, I've been in that spot, attempted suicide, and it gets better, but how do we make kids understand this? Kimball, did you hear that?
I didn't. How do we make kids understand what? I'm so sorry. You can see my ear very well, but
how do we get kids to understand that it does get better eventually?
Yeah. So kids take, and I hope the good doctor will agree with me. If she doesn't, well, let's hear from her. But kids take their cues often from adults. And if adults are stressed and don't understand that mental health is important and that there are resources available, they may do things like keep things in, not be comfortable asking for help, and things like that. So I think that's so important. And the other thing is, in 2020, we were asked as a society to pivot our total understanding of how we worked with the world and interacted with other people. And I think this is, if of all the things that have come up in the past couple of years, the fact that we need to be with people live and in person, and how important that is to our overall mental health, has just really shown itself. It's so important.
Dr. Blake, do you have anything to add to that?
Yeah, I think he's definitely has made the point there that parents need to model it's appropriate to get help and things like that. It's all very important.
Janice says sometimes children are dangerous to their families and need long-term care, but it's hard to get.
Yes.
What is your suggestion? How do you get those children? Where do you go?
So actually, if you are really struggling to get, so long-term care, we call that residential treatment is what we call that in the state of Indiana. And some parents have access to specific residential centers themselves that they may apply to. If the family's involved with the Department of Children's Services or probation services, that actually opens them up to more residential centers in the state. I think it's very hard to get residential. A lot of times you need a certain number of failed inpatient treatments before you get there. DCS does have a website that is available for parents who need residential care and can't get access to go ahead and have an interview. Usually it's at a local community mental health center, and then it helps get them into the treatment that they need. I am spacing the name of the program so I can look it up later and you can post it. But that is the one of the avenues, or else just having parents do their own research. I think I know community, for instance, if you have lots of inpatient stays there, they will help and assist you with getting residential care.
Dr. Blake, we'll start with you this time, and Kimball, you can add to that. What, as a parent, should I be watching out for in terms of whether my kids are struggling with a mental health issue?
Yeah, I think a lot of it depends on what mental health issue you're referring to. But I think, when we're looking at suicide, obviously the biggest risk factor is depression, right? So being down or sad or depressed, losing interest in things, increased irritability. We see a lot of these children and adolescents will isolate themselves more. Hearing lots of statements of like hopelessness and worthlessness, things like that are important to see. In terms of when you're thinking about the risk of suicide. Obviously there's a lot of risk factors for suicide when looking at that. A lot of times when people have big acute stressors that are happening, when you add in the mix of substance abuse on top of it, it makes them even more high risk to complete or attempt.
If I could add to what you said, Doctor, which I totally agree with. I would say that any change in your child's behavior should perk your ears up and make you curious. Some changes are perfectly fine and normal and appropriate and good, but any change should get you curious and to start a dialogue with your child to say, how you doing? What's going on? I noticed X, Y, Z. And your child, and you'll know what time during the day it's best to ask questions. Some kids are great in the morning and super chatty, and some aren't. Some you might catch right after school when they're open to discussion, and some right before bedtime. But that's a really good time to just have a standard, regular practice of talking to your kids so that they know, mom's coming or dad's coming to talk to me. It must be something bad. No, this is what we do every night. Yeah. So it's a routine.
Yeah, I agree with that. I mean, I even do that with my 5-year-old. every night we sit down and we go through her day, and I ask her, what'd you like about your day? What's something you want different or change? Because it's developmentally appropriate. And it actually, it opens those conversations for a 5-year-old to be like, okay, let's jump in and talk about this thing that didn't go as well as you wanted. And then, of course, being the psychologist I am, I do cognitive restructuring with her and do some interventions with her. But
I've noticed with my teenager, it's a very small window that I have
yes.
with her about her day, but there is still a window there, I've found. The talk of suicide is it's a sensitive topic, and it's almost like, and I've talked with students for this series of stories who said people don't want to talk about it. So how do we talk to our kids about it? Is it just a straightforward question? Are you thinking of harming yourself?
100% straightforward question. I think parents are so afraid to ask that question because they are afraid it's going to put thoughts in the child's head. Research has shown time and time again that asking the question does not increase the risk of suicide. In fact, it decreases the risk of suicide, right? Parents are often afraid that the kiddo won't be honest and open. You know, we ask these kids all the time during the first time they meet us, when they walk in our doors, we are always assessing safety, asking if they have thoughts of wanting to harm themselves, asking if they have thoughts of wanting to kill themselves, and kids are honest with us for the most part.
Someone put a link to that DCS page in the chat. So
perfect.
Thank you to Courtney for doing that. Jackie notes that it seems like help is not there until something bad happens regarding self-harm. So do you think, well, that goes to just having conversations with your kids, right?
Yeah. Just open it up and talk to them. I mean, I know it's so scary as a parent to ask if they're having thoughts of wanting to hurt themselves or having thoughts of wanting to kill themselves, especially as Kimball had mentioned, if you see any shifts in their mood or their behavior, those are always important questions to ask, and have those open dialogues and allow them to sit down and talk about difficult things at night, right, with you.
Yeah. So we're talking with a child psychologist, and we are talking with a mental health counselor, psychiatrists. Yeah. Kimball, how do I decide as a parent who my child should see? How do you differentiate that?
That's an excellent question. And again, I want to apologize to your audience for me having to look at my ear. It's very, I don't know what's going on with my phone. I can't hear you very well.
Technology. We're used to it by 2022. So, how it goes.
Oftentimes, people will start out with asking their family physician or their pediatrician, who do you recommend? Most pediatricians that I know will have access to behavioral health professionals. Some are master's degree level licensed therapists. In order to be a counselor in the state of Indiana, you do need to have a license with a few exceptions. Or you can be a licensed psychologist, as the doctor is here today, or a psychiatrist or some kind of a prescriber who can prescribe medications. Let's start out with either a psychologist or a master's prepared therapist and see if that is helpful and appropriate. And we know, me as a master's prepared therapist as well, as the psychologist, knows when we need to refer to a psychiatrist for possible extra evaluation or medication management, things like that.
Okay. Crystal had a good question. She said, and I think we can all identify with this, those of us who have older kids, that older kids, sometimes it can be harder to talk, they can be harder to talk to. So any advice, and I'll start with you, Dr. Blake, any advice for some specific kinds of questions to ask our older kids, our teenagers who may not be willing to talk all that much? Any specific way to get them talking?
I think, well, Kimball hit the nail on the head when he said, find the time when they're most open to talk to you, right? That's, I think, is number one. You're going to know your kid the best of when they're going to give you those small openings of when they're going to be, more relaxed and put their guard down to talk to you. It's just asking open-ended questions about, hey, how are you doing? Is there anything bugging you? I mean, ask those hard questions of how are things with your friends? Anything going on that you're not happy about? And sometimes you might have to ask more, like to dig, right? Anything negative happened today? What kind of emotions have you? Those kind of questions are really helpful in getting them to open up. And once you start having those open dialogues and validating your kids' feelings and allowing them the space to speak, and saying that you're non-judgmental as a parent and you're there for support, that just reinforces that they'll keep on doing it. A lot of it is a parent's response to then reinforce it, right? To make it a pleasant experience.
So I think Dr. Blake said she has children. Is that right? You have children? Yes. So I have grown children now, but when my children were younger, actually, to be honest, I'll keep this strategy. But my wife and I decided we better know our kids' friends and our kids' friends' parents. And we got very close to all of them. And we just shared together, if we have any concerns about your kids, we'll let you know. And we would really appreciate you telling us if you have any concerns that you become aware of for our children. Because the proverb says it takes a village to raise a child. And sometimes we miss things. Sometimes kids will talk to their friends or to their friends' parents before they might talk to their own parents, especially in later teenage years, I think.
That's a great point. Pamela has an interesting question. Is someone born with mental health, with a mental health issue, a mental health problem, or is it the way that people are around them? Is it developed, or is it both?
All the above. I mean, we often conceptualize people from like a biopsychosocial theory is generally what we do. So you have your biology, right, that you bring in, that you might be more genetically prone to things such as anxiety or depression or ADHD, schizophrenia, things like that. And then it's that interaction, between your environment, right, that may cause things to bloom and become problematic.
Is this medical crisis hitting all income brackets? Have you found in your experience, is this striking any particular demographic, socioeconomic, or is it across the board?
Everyone.
Oh.
I think you're seeing, and Kimball, you can speak from community, but I think we see everyone from, lower income families to very well-off families, right?
Well, and I think there are a few categories, if you will, or cultures that are a little bit more vulnerable. LGBTQ population, some folks in minority racial groups, but in general, it's an equal opportunity issue right now, if you will, that we're seeing people that have experiencing homelessness, and people that are wealthy and maybe even, don't have any financial issues, but everybody's experiencing mental health challenges. I'll put it that way.
Tracy made a really interesting suggestion. She said she's found it's important to be open and honest with kids about a family history of mental illness. She says that's really important because she says that can normalize feelings for kids and reduce that feeling that there is, quote, something wrong with me. You agree with that?
Yes, 100%. I think there's so much stigma around mental health, right? That's why we're doing more integrated care. There's so much research in that right now, so that we can get kids into pediatricians' offices and reach them that way, so there's not stigma attached to that. As much as you can talk about mental health, talk about like, hey, I get anxious sometimes, things like that. And here's what I've struggled with, things like that. Make that dialogue open. The biggest thing we have to do is take away the stigma.
Yeah, absolutely. That's the universal I've heard throughout all of the interviews.
Can I make a comment about that, if you don't mind?
Ahead. Yes, please.
And I suspect you have this too. But we sometimes have to give our clients literally a piece of paper that has a list on it of 20, 30, 40, 50 different words that express an emotion. And why is that? Well, not every family talks about feelings or emotions. And sometimes you literally have to teach people what are the words that go with what you're experiencing right now. And so just like understanding your medical history and mental health history, understanding the culture that your grandparents, your parents came from in terms of expressing anything that has to do with mental health. Sometimes kids come from families where you don't talk about it at all. They don't even know how to describe their feelings. They don't know what the words are.
Lynn wonders if you have any suggestions for any specific materials for families to read when it comes to how to talk to your child about their emotional wellness.
Kimball, I don't have a great book off my head that I can just name off. Do you have something that you recommend?
I would say that, I probably would Google it, but I would go to sites that are trustworthy. For example, most major medical centers will be trustworthy sites. The American Psychological Association, American Psychiatric Association, American Child and Adolescent Psychiatric Association, American Mental Health Counselors Association, all those things, along with, say, Indiana University or Community Health Network websites, have vetted, good, trustworthy information on them.
Or any interactive workbooks for adults to do with kids. I'm sure you could find that as well.
Yeah, they have. You just have to be careful with some of those. I know when you walk into, for instance, like Barnes and Nobles and go to the psychology section, they have all these workbooks that you can get. Those are helpful. I would recommend though doing those with a mental health professional.
Okay, good to know. Courtney wants to know, how do you feel adverse childhood experiences has an impact on your physical health? Can adverse childhood experiences have an impact on your physical health?
100%.
Well, this is somebody that has a little bit of experience, knows what they're talking about. That's called the ACEs, adverse child experience. And we know that, talk about integrative medicine, that's why it's so important to have good connections to physical doctors as well as mental health professionals. They're just not, it's hard to pry them apart. They're so important and intertwined. Adverse child experiences, the more you have, the more it affects your mental health and physical health. We know that from research.
Okay. Crystal, we're going to wrap up in about 5 minutes here. So if you have any other questions, you at home, or if you have anything you'd like to ask, please ask in the next couple of minutes and we'll try to get to it. Crystal says, my daughter told me last week, Mom, I gained 5 pounds in 2 weeks. I feel nasty and big. This is something that a lot of parents deal with in children's weight. How do you stop that from going any further? How do you have a conversation with your kids in a safe way about a healthy weight, but at the same time, not body shaming them?
Yeah, we get this all the time. I hear this all the time from kids. I do a lot of challenging the thoughts of, who is in charge of making sure you're at a healthy weight. It's your doctor, right? Is your doctor concerned? That is your doctor's job. So we'll talk a lot about that. I also tend to practice a lot of mindfulness with people and describing rather than putting in those judgmental words, because when you put in those judgmental words, that's going to lead to more emotional distress.
Kimball, do you have anything to add to that?
I love that strategy. In the bigger sense, in the scheme of things, it's called cognitive behavioral therapy, or some sorts of therapy that helps people to understand that their thinking style, their own way that they talk to themselves in their own minds, really can affect positively or negatively how you're feeling about yourself. So again, challenging those perceptions you have of yourself, offering people better and more healthy ways to think. It's great. I 100% agree with that.
All right, as we wrap up here, Dr. Blake, is there anything else you'd like to add before we go?
I think we hit a lot of it. I think the biggest thing is just, I know it's really hard to find mental health care right now. We are swamped everywhere. I think everyone is full. So, get on wait lists if you can. I've been telling a lot of families, try to get a school-based therapist if you have that opportunity, because it's easy for families, they're there. And I think we empathize with, your struggle of finding care right now. It's really hard.
Kimball?
I would encourage people, if they need to talk with someone, need information, referral, or are in a crisis, to currently call 211. It's called the Be Well Crisis Hotline, and they have trained professionals who will take the call, find out what the person needs, and make sure they get some options to connections to care.
Yeah, and absolutely. And Dr. Blake, I know when you and I talked for a story that we did not long ago, if you at home feel like your child is suicidal, momentarily, and the moment is important, go to the emergency room or feel free to call 911, right?
Absolutely. Always call 911 or take them to the nearest emergency room. Most emergency rooms will do an evaluation for you and determine what are the best next steps for your child.
All right. I know your time is so valuable. Dr. Blake and Kimball Richardson, thank you so much for your time. This has been incredibly helpful. We've had a lot of questions, a lot of comments. This is a community conversation that is so important. We're going to continue to have it in the future. Thank you both. Thanks for joining us.